So the thyroid gland is a gland that is located in the lower part of your neck. It helps to control your body's metabolism. So it's really important to control your temperature, your appetite, your weight. People with thyroid glands can occasionally have nodules develop within the thyroid gland. Most thyroid nodules are not cancerous, but some nodules slowly grow over time. Once they get to be of a certain size, they can cause some compressive symptoms. This includes problems with swallowing, some tightness in the neck. Visibly, sometimes nodules can be seen. And the typical treatment for thyroid nodules is, over the past 50 years, has been surgery to remove the nodules to address those compressive symptoms. There's a new treatment called radiofrequency ablation. Radiofrequency ablation allows patients to avoid a surgical procedure to treat a symptomatic thyroid nodule. The radiofrequency ablation is a procedure that uses a needle probe that has a heated tip that we can insert into the nodule. It can destroy the inside of the nodule, and the nodule will slowly shrink over the course of about 3 to 6 months after the treatment. Shrinkage provides symptom control. It also allows the nodule to decrease in size so that it becomes non-bothersome for patients in the future. So patients with thyroid nodules need to have 2 benign biopsies. A biopsy is performed with a small needle using an ultrasound to confirm that the nodule is a non-cancerous nodule. As long as patients have had 2 benign needle biopsies, the patient can be evaluated in clinic while we'll do another ultrasound to make sure the nodule is a good candidate for thyroid radiofrequency ablation. The nodule needs to be mostly solid on the ultrasound, and it needs to be away from critical structures that help control your voice and your swallowing. If patients can meet both of those criteria, they would be considered a candidate for the radiofrequency ablation. So once the patient is deemed a good candidate for radiofrequency ablation, we schedule the procedure in our medical procedures unit up at the Brighton Surgical Center. Patients will come in the morning. I'll see you, and the nursing staff will see you as well. We perform the radiofrequency ablation using conscious sedation. So there'll be an IV placed and then a small amount of sedation medication to help make the patient comfortable. We perform during the procedure. We also use local anesthetic to help numb the area, and then we perform the radiofrequency ablation, which typically takes about 30 to 60 minutes. During the ablation, the needle probe is inserted into the thyroid nodule, and the thyroid nodule is ablated using the radiofrequency ablation probe. Patients typically don't have any discomfort from the procedure because we use a local anesthetic, and typically the conscious sedation allows them to be comfortable throughout the procedure. After the procedure is done, the patient will be monitored in the recovery unit for anywhere from about half an hour to an hour. Once the patients are comfortable, a little bit more awake after the conscious sedation, they can go home. After the patients are discharged, typically patients can return to normal activities, usually the day after the procedure. There can be a little bit of discomfort where they need to take some over-the-counter ibuprofen or Tylenol, but most patients do well after about 24 hours. We typically perform radiofrequency ablation at the Brighton Surgical Center, which is about 20 minutes north of Ann Arbor. The Brighton Surgical Center has a medical procedures unit that we use to perform the radiofrequency ablation. I also see patients before and after radiofrequency ablation at our thyroid interventional clinic, which is also at the Brighton Surgical Center. So patients that have thyroid nodules have a couple options for treatment of their thyroid nodules. This includes the traditional treatment, which is surgical removal of the thyroid nodule. Radiofrequency ablation is a newer option for patients. Radiofrequency ablation allows for a non-invasive treatment of the thyroid nodule that does not require thyroid surgery. It's important to discuss the benefits and drawbacks of each approach, which can be very different for different types of patients. Thyroid surgery is very effective at removing the entire nodule. The downside of thyroid surgery is it does require general anesthesia to perform the surgery. There is a small scar left over after thyroid surgery, and there are some risks involved with any type of surgical procedure. The benefits of the thyroid surgery is that it will remove the nodule forever, but it does occasionally mean patients need to take thyroid medication after removal of part of the thyroid gland. Radiofrequency ablation, on the other hand, does not require general anesthesia. We can do this with a small amount of sedation in our medical procedures unit. It also does not leave a scar after radiofrequency ablation. It does make the nodule shrink in size, which can help address the patient's symptoms related to the size of the nodule. However, the nodule is not completely gone after the radiofrequency ablation, and we do need to monitor those nodules over the course of several months after the procedure.